And joining us now to talk about prevention of a third wave in Nigeria, we have Dr. Nsiabasi Kanem, a public health consultant. Good to have you join us, Dr. Nsiabasi. We see what's going on in India. Nigeria has been recording, very low number of cases in recent times. When you look at what's going on in India, what are some of the concerns that you have, especially because the WHO has now said that that variant of the virus has now been found in at least 17 countries?
Yes, thank you very much for the question. For us in Nigeria, I think what we need to do at this time is to increase our border surveillance. We need to ensure that we carry out routine tests, COVID-19 tests, to all people coming from countries like India and other countries within the Asian continent. The truth is that what is happening in India is actually a very sad situation, but the only way we can ensure that we don't have that strain in Nigeria is to ensure that we resume testing. We should not lay down our guards as far as surveillance is concerned, because if we have that strain in Nigeria, it might be difficult. Remember, we have only taken the COVID-19 vaccine from AstraZeneca, which, from what we have heard so far, is not covered by does not cover the new Indian strain. So that means that for us not to expose ourselves to the liability of having to fight a new strain of the virus, we must ensure that border surveillance of COVID-19 is strengthened, both sea border, land border, and air border. Relevant agencies must make sure that they are on their toes to screen everyone coming in from this country. That is the way.
And it's interesting you mentioned that if we have to ensure that we do not have that variant of the virus in the country, we should begin to do border checking. But there are those who are saying, because you talked about the vaccine as well, might not be effective for this new strain. And that's it's a cause of worry for people who say, look, why should I even take the vaccine if we're having new variants by the day and we're not sure that it works for these variants? What would you say to that?
No, the truth is that for now, as we speak now, the most prevalent variant of the COVID-19 virus that we have in Nigeria now, and probably many other African countries, is still very, very susceptible to the AstraZeneca vaccine, which we are taking. If we have to, if we have to ensure that we do not go into a crisis, then we must ensure that we don't import a newer strain. But for the strain that is available, the vaccine that we have, which is AstraZeneca vaccine, is very, very effective. So we should ensure that we take the vaccine, because it will definitely protect us against the prevalent strain of COVID-19 virus in Nigeria.
Absolutely. It is better to be protected against some variants while we're doing genome sequencing on other variants. Dr. Nsiabasi, it's always great to have you help us make sense of what's going on with the COVID-19 pandemic. Thanks for talking to us.
Thank you for having me.